I just wanted to yeah, make a few announcements, I guess, just to summarize a couple of things that's been going around. So first of all, uh, I think it's great news that the SNU is ready and they're going to be able to move those patients over from the GMH over to the SNS, that those who've been confirmed. And future patients will also be able to access the 20 beds that are currently available at the SNU. I think that's great news, and I want to commend GMH for getting that done, and everyone else who had to work with them. I know that they have security up there, and so and nurses, and they had to put very qualified nurses up there. So I'm hoping that worked out very well for now for the community. And I want to thank the doctors who are doing the triage and have increased their urgent care at their clinics, because this is really going to help, keep people who don't need to be at GMH away from GMH, and also help us to more quickly figure out, who's got the virus and who does not. And I feel for Dr. Akimoto and the need for test kits. We've always had this need. We were very limited in what CDC gave us, so it's not public health's fault.
Right.
They were very limited, and so of course they've asked for more. And they've been telling us they've expected it during the week. So now the latest word I got was they're hoping Monday. So I hope those doctors can just hold on, and we're going to take the samples. Hopefully they can.
I don't think it's the doctors that can hold on, though.
Yeah,
I know, but we're doing. Everyone's going to do whatever they can. So I'm just saying, if we can't control the mail, I'm sure they don't want to promise what they can't give. When they say it's going to come Monday for sure. So. But I'm hoping that it will come on Monday.
And that's part of the reason, Senator, we haven't been able to mimic some of these countries and jurisdictions and how they've been able to flatten the curve is by doing extensive testing of individuals.
Right.
And we just don't have that ability because, Dr. Akamoto checked in this morning. He said last he heard 75 tests.
Mm-hmm.
That's right. But we had 200. So we should, I'm sure they will be using them all. They're going to use all the tests. I know that's a fact. And they're expecting 400 more. So that's still relatively a limited amount. But.
Where did you hear that from?
Well,
400 more.
I'm pretty sure that's the number that we were told by public health a while ago. That's how many more they would be getting.
Okay.
And then, Senator, just to clarify, I know that they've moved one isolation patient over to the skilled nursing unit in Barragata Heights. We were on the phone with Crystal a couple hours ago. She said that it was a partial opening and that there were still a couple wings that are not ready.
Only two.
That's correct. So they're going to move 4 patients for sure. They have 60. Ultimately, they're planning for 60 beds up there. But right now, there's one wing ready with 20 beds. So that's ready to go. The next, and they're going to keep expanding, and even beyond that, they have plans to expand if we need beyond 60 beds. Then we have other contingency plans for that also. So they're just I guess doing it in phases at this point because we're all trying to catch up here. But I wanted to also announce that all the local insurance companies have agreed to expand their telehealth to cover telehealth so that relatively, so that patients can call into their doctors and receive services without necessarily having to go into the clinic. That keeps them all safe at home, hopefully, especially those who are very vulnerable, such as dialysis patients, cancer patients, and anyone else who can, get what they need over a phone, hopefully. They've also expanded up to Medicaid and MIP, so they're also doing authorizations for services by phone. They've also the insurance companies have also agreed, and the pharmacies are trying to fill this demand to cover extended periods for refills, so that everybody can get their medications either early fills or early refills or extended refills for a longer period of time. So the goal is to get people to get their medicines and so that they can shelter in place, for the duration of this.
Right, and not have to run out and be put in a position where they're out of meds or they're compromised and they're out here driving around.
We're trying to keep the compromised, all those with immunocompromised, bodies to stay in shelter as long as possible, not to be going out, not to be vulnerable to those who may be carrying the virus. And I think that's really one of the things that we're, of course, this is really the big message for everybody, is that this virus is in the community. So they've declared it to be, a community-wide. And so we all need to act as if we are infected and that we may be a potential person who is spreading this because we can't confirm that, right? So even non-symptoms, those without any symptoms might be spreading it. And so I think that's what the doctors are, they really want to stress for everyone that act as if you have it. So keep away from older people, keep your distance from people. And that's the reason. This is how we're going to save lives. It's really that individual responsibility. You act as if before, because we're not going to be able to confirm everybody. So just act as if you are contagious and act accordingly. And that's really the kind of protocol we all have to put in place. Whether the government demands it of you or is enforcing it of you, please do it for yourself and do it for those you love, because that's really the only way. And another thing I wanted to just make sure that the pharmacies want everyone to know that they are going to remain open. So you will be able to get your medicines. They're having like a rush right now that's a very high volume. That's very hard. It's hard for them to feel, of course, all at once. But so we just want everyone to also not panic about meds, that they will be able to get their meds, and that, and you'll be able to get those for extended periods. So I'm very grateful that the insurance companies, Medicaid, MIP, Department of Public Health is working very hard. They've done a lot. They've changed. They're allowing applications for online assistance of public welfare benefits. Also, you can apply online. They've got phone numbers. They're trying to get these transactions done, minimizing the need for anybody to actually come into there. So I know that, it doesn't cover everybody, but for those who can be covered, and there are people who are being laid off in the interim, I would suggest that they take advantage of the online applications for new benefits, and that,
Senator, I wanted to ask
a list of other things that I wanted to mention. Of course, the shelters are still open, so I think those types of services we have to just keep in mind that. And I know that there are many people who are existing programs. We've got existing programs that are going to cover some people. There are many people who might not be covered. I think Mary Rhodes from GHRA did an excellent job with you just a little while ago. So I'm very grateful to people like her who are very competent and who are working very hard to fill all the gaps and to make sure that, there are no gaps. But where there are gaps, we recognize that there will be gaps, and that we're going to have to fill those gaps with local programs and local ways to carry people over.
But at the same time, I think that we need to take a full advantage of what the federal government is. I mean, there's just so many different. Senator, to kind of backtrack, sorry, there was a video and audio going around yesterday, and we've run this by a few people, officials who have called into the show, just trying to vet it. We've got nothing confirmed about. I don't know if you saw this or heard this infection at GMH, a broke protocol, yada yada yada. Do you have any knowledge of that? Is that something that is unverified or verified?
Well, I heard Lillian Posadas on another radio station this morning, and what happened was that there was a patient who came in with a fever. They did not suspect him to be a PUI or a person who might have coronavirus, but he was admitted to the hospital for whatever symptoms he had. And it wasn't until, I think, 3 days later when the physician suspected he might have the coronavirus, did a test, and it was confirmed. So because of that, those who had been, I guess, treating this patient or in contact with this patient, they're now, taking measures to confirm whether or not they were exposed to the virus, whether it's been transmitted. And according to Lillian, everyone at the hospital is now wearing masks. And,
because they weren't previously?
I guess not everyone in the hospital was wearing those previously on every floor. And as you know, all across the nation, all the PPEs are being really, they're trying to push those to the front line.
Right. In fact, I saw a video yesterday, Senator, I think it was on Twitter. It was a nurse, a doctor had found a way to make more masks out of surgical gowns, and they were showing this quick fix because there's a shortage of masks, and they said, hey, we think we can make 20,000 of these masks, and you get them where they need to go. So I think it's really interesting that the people on the front lines are finding creative but, safe ways to deal with so many of the shortages that we're seeing because of this unprecedented pandemic.
Yeah, people are getting creative, and I think we need to get creative too, of how we stay at home and get things done still, or we stay at home and still not let our parents feel isolated or things like that. And that's what I'm asking the community to do. That take it upon yourself. You don't wait for the government to force you. Just do it. You've got to do it. You've got to act as if you are infected and stop contact with everyone else. Yeah.
Okay, Senator. Is there anything else you wanted to add?
Well, if I could, I would just like to thank you, as you guys are interviewing a lot of people, and I want to thank you for getting the message out there. I think, of course, it's possible the government could do a better job of getting the information out faster, and I still think the more the better, right? That if everybody knows everything, they're going to feel more confident.
Right.
But I do know that the heads, for example, of the hospital and the heads of the public health are working so very hard that they just don't have all that time in the day.
Yeah.
But I do want to commend all of our people working on health in the health fields. Because they are taking much risk. I have a brother who's a doctor, and every day I feel for him because he's isolated himself from our family because of this. And so that all these doctors, all these nurses, everyone working at the hospital in any capacity is dealing with this every day, that they are at risk and they bring risk to their families. So they're going to have, our lives are changing very quickly. So I'm just saying, do your part. Yeah, please stay at home. I'm very glad that the governor put the quarantine measures in place, the mandatory ones. I very much appreciate that. I think that was very much needed, and so I'm glad to see all the people who cooperated to get that in place. And I'm glad also for her executive order yesterday that closed a lot more things, that put people home. I think we need more. I think the more we do, the less we are going to spread. And because we can't test everybody, because we can't treat, possibly everybody, we need to stop the spread, and it's urgent. It's very urgent.
Right, Senator. So let me ask you: a couple days ago, you were one of 10 senators who asked the governor for this total lockdown. Are you saying that you're satisfied? You guys didn't get that, but you kind of got the next best thing.
Well, no. I mean, I think there's still something, of course, one of the things that we had asked is that they ask for, FAA's assistance to stop the flights. So, but I think what she has done is going to be effective. So I'm very grateful for that. And we also asked that for a complete lockdown, right, everywhere.
Right.
But I appreciate how I think we can maybe debate about whether certain things are necessary or not, and that's kind of where the discretion is coming in. But of course there are necessary things, like food has to get to the hospital, for example, right? They've got to get to the shelters. We're putting people in quarantine, so there's some activity that's going to have to happen necessarily, but we just keep having to trim that down to, unless it's absolutely necessary, cut it off. I still believe that.
Well, we thank you so much for taking your time and reaching out to us and talking to the community through KUAM, and be safe.
All right. Thanks so much.
Wash your hands, Senator.
I will, of course.
Okay. Thank you. All right. There you go. Wow, a lot of great insight there from that phone call. You see the thing about, the thing that I love about us. I'm not a horn tutor.